strep throat, that fiery, scratchy feeling that makes even swallowing feel like a battle. You hear a lot of chatter about antibiotics, and a name you may have come across is ciprofloxacin or just Cipro. But hold on! Before you reach for that antibiotic, let's dive into the truth about using ciprofloxacin for strep throat.
First things first, what exactly is strep throat? It's a bacterial infection triggered by a little troublemaker called Streptococcus. This infection sets your throat on fire with symptoms like pain, white patches on your tonsils, fever, and swollen lymph nodes. Strep throat, while super annoying, sometimes resolves on its own within a week.
Now, let's talk about ciprofloxacin. This powerful antibiotic battles a wide range of bacterial infections, and yes, it can tackle the Streptococcus bacteria. But here's the thing, it's not always the go-to for strep throat.
Doctors have their favourites when it comes to strep throat. Think of them as the A-team of antibiotics, penicillin and amoxicillin. Why? They're highly effective against Streptococcus, and they have a safer track record than Cipro. Plus, experts warn about antibiotic resistance, those sneaky bacteria that become tougher to beat. We want to reserve powerful medications like Cipro for situations where they're truly essential.
Of course, there are exceptions. Here's where ciprofloxacin might be your hero. Penicillin allergy. If you have an allergy to penicillin, ciprofloxacin becomes a crucial alternative. Penicillin is a first-line defense against strep throat, but if you're allergic, it's off the table. In such cases, your doctor might prescribe ciprofloxacin to target the Streptococcus bacteria effectively. Antibiotic resistance. In some unfortunate cases, the Streptococcus bacteria itself can become resistant to commonly used antibiotics like penicillin. This means the medication isn't strong enough to combat the infection. If your doctor suspects antibiotic resistance, ciprofloxacin might be used as a second-line defense to fight the tougher bacteria.
Remember, like all superpowers, Cipro comes with a potential kryptonite. Side effects. These are often mild. Think tummy troubles or feeling out of sorts. But in rare cases, ciprofloxacin can cause more serious issues. It's crucial to talk these over with your doctor.
While antibiotics might do the heavy lifting, don't underestimate the power of good old-fashioned self-care. Here's your home remedy toolkit to battle strep throat. Gargle with warm salt water. This age-old remedy works wonders. The salt helps reduce inflammation and soothe the scratchy feeling in your throat. Mix a half teaspoon of table salt into a warm glass of water and gargle several times a day. Hydration is key. Sore throats can make swallowing uncomfortable, but fluids are essential to fight infection and loosen mucus. Opt for warm liquids like soothing broths, herbal teas, or plain water with a touch of honey. Lozenges and humidifier. Lozenges can provide much-needed relief from a scratchy or sore throat. Look for lozenges that are sugar-free to avoid irritating your throat further. Consider using a cool mist humidifier to add moisture to the air, especially at night, to ease congestion and coughing. Plenty of rest. Your body needs all its energy to fight off infection. Get plenty of sleep and take breaks throughout the day. Don't forget to listen to your body and avoid strenuous activity. Soothing throat pain. Over-the-counter pain relievers like acetaminophen or ibuprofen can help manage fever and throat discomfort. Make sure to follow the dosage instructions carefully.
Remember, antibiotic overuse is a serious problem fueling the rise of superbugs, bacteria becoming resistant to our best weapons against them. Taking antibiotics when they're not necessary can weaken their powers for when you really need them. Using ciprofloxacin only in the right circumstances is vital for preserving our antibiotic arsenal for the future.
While home remedies are great, sometimes you need a doctor's help. Here's when to call the medical professionals. High fever. If your fever goes above 101 degrees Fahrenheit, 38 degrees Celsius, or doesn't come down with medication, difficulty swallowing. If it's more than mildly difficult to swallow food or liquids, trouble breathing, Any wheezing, shortness of breath, or trouble breathing requires immediate medical attention. Symptoms last longer than a week. Despite self-care, if your strep symptoms don't show signs of improvement after 7 days,
Ciprofloxacin can interact with other medications, sometimes in dangerous ways. It's essential to tell your doctor about all medications or supplements you're taking beforehand, including blood thinners, diabetes medications for epilepsy or seizures. The bottom line? Ciprofloxacin can be a lifesaver if you've got a tough case of strep throat, but for most penicillin and amoxicillin are the go-to choices. Always consult your doctor to pick the best treatment for your situation.
have you had any experiences with using ciprofloxacin for strep throat? Share your story in the comments to help others. Like this video if you found it helpful, and don't forget to subscribe so you never miss an informative health video.